Imagine a conversation that could change the course of your health, one that every man over 60 urgently needs to have, yet almost never happens in a doctor's office. I'm not talking about complicated surgeries, expensive medications, or miracle supplements. I'm talking about 3 simple, practical daily habits that can protect your prostate for years to come. These habits are backed by solid science, proven through real-world results, and surprisingly, most men overlook them entirely. My name is Dr. Shant, and in my 18-plus years as a urologist, I've seen how these small, consistent lifestyle changes can dramatically reduce urinary discomfort, improve quality of life, and even prevent serious prostate problems. If you are over 60, or if you have a father, brother, or friend in this age group, I urge you to watch and listen carefully. At least one of these habits will surprise you, and it might completely challenge what you've been told about prostate health. Why the prostate needs special care after 60. Your prostate is a small gland, roughly the size of a walnut, but its impact on male health is huge. It sits just below the bladder, wrapped around the urethra like a ring, and plays a vital role in producing seminal fluid. For most of your life, you probably never think about it until problems begin. As men age, particularly after 50, hormone changes, especially fluctuations in testosterone and related compounds, cause the prostate to grow. This enlargement, called benign prostatic hyperplasia or BPH, is extremely common. At 60, roughly 6 in 10 men already have some degree of BPH. By 70, that number rises to 7 out of 10. For some, the growth is mild. For others, it causes daily frustration, struggling to start urination, a weak stream, that constant feeling your bladder never empties, and perhaps the most exhausting symptom, waking multiple times at night to use the bathroom. Hear us the truth, these symptoms are not just a normal part of aging you have to accept. Research shows there are natural, low-cost, daily actions that can slow, stop, and sometimes even reverse these problems. Today, I'll share 3 of the most effective ones. Habit 1. Strategic hydration. Yes, everyone knows drinking water is important, but very few men know how to hydrate in a way that truly protects the prostate. It's not only about how much water you drink, but when you drink it. Many older men unintentionally live in a state of mild dehydration. As we age, our sense of thirst becomes less accurate, so we drink less during the day. Then, in the evening, they realize they've barely had any fluids and end up drinking large amounts all at once. That's a problem. When you're dehydrated, your urine becomes darker and more concentrated, filled with irritants and toxins. This concentrated urine irritates your bladder and inflames your prostate, worsening urinary symptoms and increasing nighttime trips to the bathroom. Studies show that men who consistently drink less than about 1.5 liters of water a day often have more severe urinary issues than those who drink 2-3 liters spaced out over the day. The fix? Front-load your hydration. Drink most of your fluids in the morning and early afternoon, ideally about 70% of your daily intake before p.m. After that, slow down your fluid intake, only sipping small amounts if you feel thirsty. This approach hydrates your body and prostate without overloading your bladder at night. I tell my patients to start each morning with a full glass of water immediately after waking. Sip consistently through the day, and if you enjoy tea or other drinks, have them before dinner. By doing this, you can cut nighttime bathroom visits by as much as 40%, improve your sleep quality, and reduce irritation in your urinary tract. Better hydration equals better sleep equals lower inflammation. And when inflammation is reduced, your prostate works more efficiently. Habit 2. Walking after meals. The second habit is just as simple, yet most men underestimate its power. Take a 10-15 minute walk after lunch and dinner. It might seem too small to matter, but here's why it works. When you walk after eating, your body increases blood circulation to your pelvic region. More blood flow means more oxygen and nutrients delivered to your prostate, helping it function better and reducing chronic inflammation, one of the main drivers of prostate enlargement. It doesn't stop there. Walking after meals also helps regulate blood sugar. That's critical because poorly controlled blood sugar and diabetes are strongly linked to faster prostate growth and more severe urinary symptoms. In fact, research shows that older men who take short, low-intensity walks after meals have significantly lower inflammatory markers in their blood. This isn't just good for your prostate, it benefits your heart, your brain, and your joints too. The best part? You don't need to power walk or break a sweat. Even a gentle stroll around your home, in your garden, or down the street is enough. What matters most is consistency. Do it every day, and over time, this habit can reduce your risk of serious prostate complications by more than a third. Habit 3. Maintain a healthy sexual life. Now for the third habit, one that can be a little more sensitive to talk about: maintaining regular, healthy sexual activity. For decades, studies suggested that frequent ejaculation around 21 times per month lowered prostate cancer risk. But newer research is showing that the type of sexual activity matters too. Partnered intimacy, sex with a partner, offers benefits that go beyond mechanical release. It triggers the release of oxytocin, the bonding hormone, and lowers cortisol, the stress hormone. It improves pelvic floor muscle relaxation, increases circulation in the pelvic area, and enhances emotional well-being. All of these help keep inflammation in check, which directly benefits your prostate. On the other hand, frequent solo activity masturbation doesn't seem to provide all the same hormonal and physical benefits. When done excessively, it can even cause pelvic muscle tension that may irritate the prostate. This doesn't mean masturbation is harmful in moderation, but for optimal prostate health, quality matters as much as quantity. If you have a partner, regular intimacy is one of the best things you can do for your prostate. If you don't, talk to your doctor about other ways to improve circulation and pelvic health, such as pelvic floor exercises, stress reduction practices, or other safe physical activities. Bringing it all together, these 3 habits: strategic hydration, walking after meals, maintaining a healthy sexual life, are simple, free, and can fit easily into your day. But here's the key: their benefits multiply when you combine them with other healthy practices. That means eating a prostate-friendly diet rich in antioxidants like lycopene from cooked tomatoes, cruciferous vegetables, broccoli, cauliflower, cabbage, and zinc-rich foods, pumpkin seeds, nuts, seafood. Maintaining a healthy weight, because excess belly fat increases hormones that fuel prostate growth. Managing blood pressure, cholesterol, and blood sugar. And most importantly, regular checkups. Men over 60 should see their urologist at least once a year for a PSA test and prostate exam. Early detection makes treatment easier and more effective. Final thoughts: I've seen men in their 70s and even 82s adopt these habits and experience life-changing improvements. Fewer nighttime trips to the bathroom, stronger urinary flow, better sleep, and more energy. If you take just one thing away from this, let it be this: you are not powerless. Whether you're 60, 70, or beyond, you can take control of your prostate health starting today. Here's your challenge: write down these 3 habits. Post them somewhere you'll see every day: your fridge, your bathroom mirror, or your desk. Start with one habit tomorrow. Add the others over time. Your prostate health isn't just about avoiding discomfort, it's about protecting your independence, dignity, and quality of life. Take care of your prostate, and it will take care of you.